Hello, thank you for watching Opioids, Naloxone, and First Responders. First, let me introduce myself. My name is Taylor Bybee. I am a health education specialist at South Central Public Health District, and my primary focus is on drug overdose prevention, particularly opioids. I am required to post this slide as I am funded by the CDC so I can do these presentations. However, the CDC does not dictate what I put in these presentations. Therefore, the material in this presentation may or may not represent the official views of the CDC. So what are prescription opioids? Prescription opioids, or painkillers, are medications that are prescribed by a healthcare provider. Opioids are also used to treat moderate to severe, short-term, or long-term pain. The chart on the right is a list of different opioids. They can differ in strength. For example, codeine is about 1/10 the strength of morphine, but oxymorphone is 3 times stronger than morphine. However, opioids come with some risks. The first risk is addiction. The issue with addiction is the longer that opioids are taken, the higher dose of opioids are needed to have the same effect. This can cause a person to take more and more opioids, which can lead to the second risk, which is overdose. An overdose can also cause death. A lot of overdoses are accidental. For example, let's say an elderly woman breaks her hip. She goes through the proper treatment and gets to go home. One day she wakes up and takes her medications, including her opioid. She then makes some breakfast, and afterwards she still feels pain in her hip and decides she must have forgotten to take her painkiller. She ends up taking another dose of her opioid prescription and possibly overdoses. The third risk is pregnancy complications. It can cause problems for the mother and the baby. There are multiple side effects that can occur from opioids. The first is sedation, which is a fancy word for causing sleepiness. Other side effects include constipation and respiratory depression. And respiratory depression is a fancy word for slowing down of breathing. Respiratory depression is the reason an opioid overdose can cause death. When an overdose happens, breathing slows down to a dangerous level or stops completely. There are also illicit or illegal opioids. The most common illicit opioid is heroin. Heroin is 2 to 5 times stronger than morphine. Fentanyl is another illicit opioid that is becoming more common. Fentanyl is 50 to 100 times stronger than morphine. It is becoming more common for fentanyl to be mixed with heroin to make it more potent without the knowledge of the user. Carfentanil is an opioid that isn't very common because it is extremely potent as it is 10,000 times stronger than morphine. Carfentanil is sometimes used to tranquilize bigger animals such as elephants. As you can see, the risks of illicit opioids are the same as prescription opioids. However, these risks are higher with illicit opioids, because with prescription opioids, if they are used as prescribed by doctors, then these risks are a lot lower. However, illicit opioids do not come with instructions, which can increase the likelihood of overdose and other risks. This image shows lethal doses of the 3 illicit opioids I mentioned before. Notice how little fentanyl and carfentanil is needed for a lethal dose. They're both so potent that it is possible to overdose just by touching them with your bare skin. This is a chart that compares drug overdose rates on average between the United States and the state of Idaho. The solid line represents Idaho, and the dotted line represents the United States. As you can see, drug overdose rates have been increasing since the year 2000. In Idaho, the death rate has almost tripled since the year 2000. In the United States, the death rate is over triple since the year 2000. It is estimated that 2020 will have increased mortality rates for both the state of Idaho and the United States due to the COVID pandemic. It is important to be able to recognize an opioid overdose so they can receive the proper treatment as soon as possible. The first sign is small or pinpoint pupils, where the pupils will become so small that they look unnatural and you can barely even see them. Falling asleep and a limp body are signs of the sedation side effect that I mentioned before. Slow, shallow breathing, choking sounds, gurgling sounds, and pale blue or cold skin are signs that respiratory depression has occurred and the person is struggling to breathe. Finally, needles or empty pill bottles around the person is a sign that they may have overdosed. If an overdose is suspected, it is important to call 911 as soon as possible. The faster the person gets treatment, the higher likelihood of a full recovery. Naloxone, sometimes called Narcan, is a medicine that can temporarily reverse an opioid overdose by restoring breathing. There are 3 forms available, which are a nasal spray, an auto-injector, or injection by needle and syringe. The nasal spray is the most common form of naloxone. There is no certification required to use it. It is the cheapest, and it is available in many pharmacies in the community. An auto-injector is similar to an EpiPen. This form isn't very common as it is expensive. The third form of naloxone is injection by needle and syringe. This form is usually only available in healthcare settings, as one would need training to be able to use a needle and syringe. It is important to note that naloxone only works on opioid overdoses, such as prescription opioids, heroin, and fentanyl. It will not work on a cocaine overdose, methamphetamine overdose, or other types of drugs. It is important to note that the effects of naloxone only last between 30 minutes to an hour. It's possible for someone to go right back into the overdose state if they don't get medical treatment after receiving naloxone. Naloxone is available for first responders in Idaho through the Idaho Office of Drug Policy's mini-grant program. You can visit the Idaho of Drug Policy's website to receive more information about the grant and to apply for naloxone. I can assist with the application for the grant if needed. If you would like assistance, my contact information will be at the end of this presentation. It can be very beneficial for first responders to have naloxone available. The first reason is that first responders are typically the very first to arrive at the scene of an overdose. If an overdose has occurred, it is important for the person to get naloxone as soon as possible. The longer the person waits for naloxone, it is more likely for death or serious side effects. The second reason is a first responder may have an accidental overdose occur. For example, a police officer in Ohio arrested someone for a car theft. The officer saw some white powder on his clothes and brushed it off with his bare hand. The white powder was fentanyl, and the officer accidentally overdosed. Luckily, the officer's partner was there and gave him naloxone, and the officer made a full recovery. So what should you do if you encounter an overdose? The first thing you should do is make sure the area is safe. Examples of possible hazards can be blood, syringes, and others. And putting on gloves would be ideal. The next step is to try to rouse the victim and try to get them to wake up by shouting or rubbing their chest with your knuckles. And also check the person for breathing and a pulse. If the person responds, then try to keep them awake until EMS arrives. If medical assistance is not already arriving, then call them if the person is unresponsive. Next, administer naloxone if you believe the person is experiencing an opioid overdose and they are not breathing. Hold it as shown in the picture, and then put your nozzle up the nostril and press down with your thumb. The top of your finger should be touching the person's nose. Use about half of the dose in each nostril. Administer CPR if the person doesn't have a pulse and or rescue breaths if the person is not breathing. If the person does not respond after about 3 minutes, then administer a second dose of naloxone. Repeat this step until the person starts breathing or until EMS arrives. If the victim starts breathing, put them in the recovery position to wait for EMS. It's important to put them in this position because vomiting may occur and the person could aspirate if they are on their back. And try to keep them awake until EMS arrives. Reversing an opioid overdose may cause some side effects. These side effects don't always happen, but they have occurred in the past. Side effects can include vomiting, diarrhea, anxiety, confusion, anger, verbal threats, desire to take drugs, and seizure-like behavior. Inform EMS if these side effects occur. You may have heard of the Idaho Good Samaritan Law if you have ever became CPR certified. The Idaho Good Samaritan Law protects someone that is doing CPR from legal repercussions. The Idaho Good Samaritan Law is also used for protections regarding naloxone. The first section states that any person can administer naloxone, but should contact emergency services as soon as possible. And there is no special training required to be able to use Narcan, which is the nasal spray. The second section states that if a person administers naloxone, they will not be liable in a civil or administrative action or subject to criminal prosecution. This is the case because naloxone doesn't cause any side effects to a person not experiencing an overdose. Finally, if someone is seeking or needing medical assistance for a drug overdose, they will not be prosecuted. This is to encourage people struggling with drug misuse disorder to receive treatment to help overcome their addiction. It is important to store naloxone correctly. Storing naloxone incorrectly can decrease the likelihood of it working when needed. The first way is to keep it in room temperature. If it is a temperature that you are comfortable in, then the naloxone should be fine. It is also important to keep naloxone out of sunlight. Sunlight can damage the naloxone by heating it up or by the radiation from the sun. Keep the naloxone out of reach of children, which should be done for any type of medicine or medication. Let others know where it is stored in case of emergency. Finally, know the expiration date. Naloxone has a shelf life of about 18 months to 2 years. If it is expired, then it needs to be replaced. There are multiple treatment and support services in the area. One resource is medical professionals trained in medication-assisted treatment, or MAT for short. MAT-trained professionals can treat people with opioid misuse disorder to assist with overcoming addiction. There are currently MAT-trained professionals in Twin Falls, Cassia, Lincoln, Gooding, and Burleigh counties. There is also a 24-hour crisis center in Twin Falls, as well as recovery and support centers throughout the district. You can see a map of these resources on the Public Health District's website. You can also contact me for an Excel list of these different resources. If you have any questions, please feel free to contact me by email or by phone. And these are the references that were used for this presentation. Please feel free to visit them to learn more. Thank you for watching my video presentation.